Ultrasound is the gold standard to diagnose disease of the scrotum and testicles. It's a common and important protocol in ultrasound department. Of course, ultrasound with Doppler evaluation is the imaging modality of choice for the evaluation of the scrotum. Nothing is better, nothing is safer than ultrasound in an important organ as testicles. High frequency ultrasound is the best for testicles because there are organs that are really superficial. A difference of the ovaries that are deep in the abdominal cavity, testicles are superficial, and a lot of different disease can be diagnosed with scrotal ultrasound. Scrotal pain, scrotal mass, trauma, there are a lot of disease that can be diagnosed with ultrasound. Of course, color Doppler is very important. All protocols of testicular must have color Doppler and also a spectral Doppler that is more objective than color Doppler. If you have the suspicious of infection, of a cancer, color Doppler needs to be performed. Also, with ultrasound, you can differentiate if the diseases are testicular or extratesticular. Anatomy of the scrotum. The most important organ that is in the scrotum are the testes. Are symmetrical oval-shaped glands and are also called gonads. In the adults, in general, measure 3 to 5 centimeters in length. Each testis is divided in lobules. Each testis have from 200 to 400 lobules, and each lobule have a seminiferous tubule. This tubule converge in one part called rete testis in the mediastinum of the testis. The rete testis go to the epididymis through the efferent ductus, other tubules that are the continuation. Sonographical, the testes are gray with an echo texture similar as other organs, ovaries, spleen, liver. The epididymis or epididymus is a 6 to 7 centimeters tubular structure that is posterolateral to the testis. You can see in the ultrasound that the epididymus is little hypoechoic as the testicle. The epididymis is divided in head, body, and tail. The head is the easy part to visualize and is around 6 to 15 millimeters. Is superior to the superior pole of the testis. It contains 10 to 15 efferent ductus These tubules converge to form a single duct in the body and tail. This duct is known ductus epididymus. It becomes the vas deferens and continues in the spermatic cord. The body of the epididymus is not as easy to visualize like the head. The tail is slightly larger and is posterior to the lower pole of the testis. The normal epididymus usually is iso or hypoechoic compared with the testis. The testis is completely covered by a dense fibrous tissue termed the tunica albuginea, very hard. Multiple septa are between the lobules and separate one lobule to the other. The mediastinum is a bright hyperechoic line in the middle of the testis. The tunica vaginalis line the inner wall of the scrotum, covering each testis and epididymus. It consists in two layers, parietal and visceral. Why? Because the tunica vaginalis is the continuation of the peritoneum. It's the same peritoneum that's coming with the testicle when the testicle left the abdominal cavity and entered in the scrotum. And this is for that the tunica vaginalis as peritoneum have two layers, the parietal that is covering the scrotum and the visceral that is around the testis. The parietal layer is the inner lining of the scrotal wall. The visceral layers surround the testis and the epididymus. The space between the layers of the tunica vaginalis is where hydrocele or other fluid is going to accumulate, exactly like ascites accumulate in the peritoneal space. The vas deferens is the continuation of the ductus epididymus, is thicker and less convoluted. You can see here that the vas deferens coming inside the abdomen go over the ureters and finish in the seminal vesicle. The vas deferens dilate at the terminal portion near the seminal vesicle. This portion is termed the ampulla of the deferens. The vas deferens testicular arteries, venous pampiniform plexus, lymphatics, autonomic nerve, and fibers of the cremaster form the spermatic cord. Vascular supply of the scrotum and testis. Right and left testicular arteries arise from the abdominal aorta. You cannot see with ultrasound, but they begin just below the renal arteries. They course along